A 65-year-old female patient experiencing dizziness and lack of balance is brought to the emergency room by spouse. Nurse No assesses the patient. She looks pale, complaints of black tarry stool since yesterday. Vital signs temperature 97.2, respiration 24, blood pressure 90 over 76, heart rate 110, oxygen saturation 93%, and hemoglobin is 7. Just 7. That shows that slow GI bleeding is going on. We need to quickly stabilize the patient, administering IV fluids to restore the blood volume, oxygen to improve tissue perfusion, and blood transfusion if the hemoglobin drops too low. To confirm the diagnosis and to stop bleeding, next step is to perform an endoscopy to look for the bleeding ulcers, and it can be fixed with treatment like banding and cauterization of the ulcer. Once the bleeding is controlled, we will need to address the underlying cause. In our patient, the cause was excessive use of over-the-counter medication called Excedrin. That's the combination of aspirin, caffeine, and acetaminophen. Now, the aspirin is the NSAID group of medication that leads to GI bleeding. As a nurse, we need to educate to the patient to discontinue NSAID, main culprit for GI bleeding. And we need to include the medications like proton pump inhibitors and antibiotics if H. pylori infection is suspected. Remember, for the exam, NSAID causes GI bleeding.